Victoria has yet again broken its own record for the biggest daily caseload increase during the pandemic. 532 new confirmed COVID infections and 6 deaths, 5 linked to aged care facilities. Now, of those 6 deaths, 1 woman was in her 90s, another female in her 80s, a man in his 80s, a woman in her 70s, and 2 men in their 70s and 50s. There are now 683 active cases linked to aged care facilities, approximately 400 active cases among health workers. Victorian authorities also confirmed 4 cases have been linked to the intensive care unit at the Royal Children's Hospital in Melbourne. 2 parents, 1 baby and 1 healthcare worker tested positive. All babies, as well as staff and parents who have been in the ward for more than 2 hours since July 12, will now be tested. Today's record increase of 532 cases marks 7 straight days of infections rising above 300 daily, casting doubt over whether the lockdown can end as scheduled on August 19th. In New South Wales, meantime, it's recorded 17 new cases of coronavirus, 8 of which are in hotel quarantine. 3 cases are linked to the Thai Rock restaurant in Sydney's southwest and 4 to a funeral cluster in Sydney. There is cautious optimism that New South Wales has its current COVID spread under control, the Premier, Gladys Berejiklian, declaring the state is doing okay. Let's look at the situation nationally now. There are more than 4,700 cases. The total active caseload set to pass 5,000 tomorrow if that trajectory in Victoria continues. All states and territories, with the exception of New South Wales and Victoria, are currently not recording cases of community transmission, with their cases confined to quarantine. Now, several industries in Victoria face a possible shutdown if the workplace transmission continues. The state recording its highest surge in cases, now nearly halfway through its lockdown.
Victoria's coronavirus case numbers are supposed to be coming down. Instead, they're at record levels.
There are 8,696 coronavirus cases in Victoria. That's 532 new.
With that unprecedented increase comes more tragedy. A further 6 deaths, the youngest a man in his 50s, the others 5 elderly residents linked to aged care. 245 Victorians are in hospital, 44 of those fighting for life in ICU. The pandemic now taking its toll on the healthcare system, with more than 400 workers in isolation after testing positive to COVID-19.
Certainly, these are very challenging numbers. We're at a very challenging stage with this wave.
There are 2 major areas of transmission. The first in workplaces, mainly abattoirs and small goods warehouses. The industry faces a tough crackdown if the situation deteriorates.
Next steps may well have to include closing a number of these industries if we continue to see people attending work.
The second is aged care, now at crisis point. Dozens of facilities have been compromised, with nearly 800 infections in the system, split between vulnerable residents and staff. Some of these outbreaks are nearing 100 cases. Deaths from facilities account for a third of the state's death toll. During the second wave, it's more than half, and the worst could be yet to come.
The residents in these facilities will be people's parents, grandparents, great-grandparents, and they are at significant risk of dying. That's an inescapable fact.
Melbourne and Mitchell Shire are now nearly halfway through the 6-week lockdown, but active cases continue to go up and up. An extension and expansion of the tough measures now looking more and more likely by the day. Modelling shows the reproductive rate of the virus is either at 1 or even below. Cold comfort for those who have lost loved ones, but a sign Victoria may be on the cusp of turning the crisis around.
Today should be the peak. Now, I'm not going to sit back and say today's the peak.
The next few days will be crucial in deciding if more drastic action is taken. Patrick Morrell, Sky News, Melbourne.
As coronavirus cases in Victorian aged care facilities approaches 700, governments are scrambling to halt the outbreaks. Casual workers will be prevented from jumping between centres in a bid to stop transmission.
Hundreds of senior citizens are facing a life or death battle with COVID-19. Over the past 24 hours, 5 out of 6 Victorians who have succumbed to the virus were aged care cases.
They represent a tragedy for the families involved.
The biggest nursing home outbreak, 84 cases connected to the St Basil's facility in Melbourne, residents in harm's way at dozens of other centres.
This is 683 active cases connected in some way to aged care.
It's really distressing for everybody. Sorry. Aged care providers are doing everything that they can.
But the virus is still being spread by casuals working across multiple nursing and retirement homes. That movement will no longer be allowed. Providers and unions striking a deal for employees to nominate their primary workplace, which will need to provide them with extra shifts they were getting elsewhere.
Multiple outbreaks across multiple settings happened because of that mobile workforce, and so that has been addressed.
The federal government agreeing to compensate workers if there's a hit to their income.
We'll support that so that staff aren't disadvantaged.
Some aged care homes claim they're being disadvantaged by an insufficient supply of personal protective equipment. PPEs reportedly flowing to centres grappling with outbreaks, but not as quickly for those trying to stop the virus getting in.
So providers are getting PPE, but sometimes there are delays of days before they can get it.
I'm not aware of any aged care facility that is short on PPE.
The Commonwealth has provided 1.5 million masks to the state's aged care sector, the Prime Minister not wearing responsibility for any shortfalls.
The Commonwealth is not the only level of government that provides PPE material into the health system. Of course, the state governments also do that and, in fact, are the primary providers of that equipment into health care facilities.
With lives on the line, there is a collective hope the crisis plaguing the sector can be brought under control. Eliza Edwards, Sky News, Canberra.